Good afternoon. My name is Ankoor Shah. I'm a pediatric doctor, and I'm representing the District of Columbia chapter of the American Academy of Pediatrics. So the American Academy of Pediatrics is a 60,000-member organization of pediatricians all across the country. Our DC chapter has over 400 pediatricians, training pediatricians through schools, school-based clinics, and hospitals. This bill will save lives. That's pure and simple. I remember when I was a training pediatrician, I was working in the emergency room one day, and a 16-year-old came through the doors in a stretcher unconscious. Just a little bit before, he was playing baseball, and he fell down and collapsed suddenly, no heartbeat, no breaths. At that point, every minute, actually every second counts. Luckily, there were paramedics at the game. They were able to do CPR and use the AED immediately. So when he came to the emergency room, he was unconscious but had a pulse. And I think that's what makes a difference. That's the reason he's alive today. So when I think back on my patient on that case, I wonder what would happen if the paramedics weren't there. My hope is that someone else that knows CPR or AED would be available. But what the Cardiopulmonary Resuscitation and Automated External Defibrillator Requirements Act of 2015 does is it makes my hope a reality. So thinking back about my patient, he had no medical problems. He didn't have any history of cardiac disease, and I think that's what scares me the most as a general pediatrician. As a general pediatrician, I'm hoping I could catch murmurs, or if there's a family history of really bad cardiac disease, I'll be able to catch that and send it to a cardiologist. But with syndromes like Al-Kappa, anomalous left coronary artery from the pulmonary artery, there is no murmur, but that syndrome of diseases, coronary artery abnormalities, are the second leading cause of sudden death in teenage athletes. Things like long QT syndrome, which is a heartbeat irregularity, can cause sudden death. And this syndrome is genetic. But we often don't even we don't get a good family history because there might be a history of unexplained drowning or a car accident we don't know that's kind of hiding this fatal cardiac disease. And as a district ever becomes more globalized and more international, we have children from all over the world coming here who might not have as good screening as we do in the United States, and therefore higher cardiac diseases. And also, what we're able to do with infants with cardiac diseases, the surgical procedures we're able to do, they're unbelievable. But what that means is we're having an increased incidence of children with congenital heart disease in our schools. So I only see this bill being improved or being used more and more as time goes on. So keeping all this in mind, I believe there's still one huge gap in the bill. We at the DC chapter of the American Academy of Pediatrics truly believe that a required CPR and AED training is needed for all students before high school graduation. By adding this provision, you would join 27 states that include it already. And you're dramatically increasing the number of first responders in the school and community because most of the states in the district and the surrounding area, since most of the students stay in the district, you're actually thousands and thousands of citizens will be armed with how to save a life. But even beyond the obvious life-saving impact, this requirement will benefit the development of our teenagers becoming young adults. During the teenage years, adolescents move from concrete thinking to abstract thinking. They start learning about themselves and their identity within the world. So by having our students learn CPR and AED skills, we are ingraining a sense of social responsibility that they will carry well beyond high school.
Dr. Shaw, if you could summarize for me, I'd appreciate that.
So overall, I just want to take this huge moment to thank you for presenting such a game-changing bill and for considering making it even stronger by requiring CPR training for high school students and thus creating a sea of student lifesavers. Thank you.
Dr. Berul.
Thank you. Good afternoon. My name is Dr. Charles Berul. I'm the Division Chief of Pediatric Cardiology at Children's National Medical Center, and I also serve the American College of Cardiology's Board of Governors representing cardiovascular specialists in the District of Columbia. I'm also a third-generation native Washingtonian, born and raised in the area. I testify on behalf of the American College of Cardiology, which strongly supports measures to reduce mortality from sudden cardiac arrest. The ACC is a 49,000-member medical society that is the professional home for the entire cardiovascular care team. The mission of the college is to transform cardiovascular care and improve heart health. The ACC leads in the formation of health policy, standards, and guidelines, and operates national registries to measure and improve care. They provide professional medical education and disseminate cardiac research and bestows credential among cardiovascular specialists. An important strategic objective embraced by the college is improving population health, particularly in the District of Columbia, the location of our worldwide headquarters. If I may digress very briefly, I thank the Council for its fine work in its enactment of legislation requiring newborn screening to detect critical congenital heart defects in DC birthing centers, and we look forward to working with the Council to craft solutions to other population health initiatives, including those included in this bill. Sudden cardiac arrest constitutes a medical emergency. If not treated immediately, it causes sudden death. With fast, appropriate medical care, survival is possible. Administering CPR, even just compressions of the chest, can improve the chances of survival until emergency personnel arrive. Early bystander intervention with CPR before emergency help arrives results in survival of approximately 4 out of 10 victims, and even in the best emergency medical services may not be able to reach a victim within the first 3 to 5 minutes. Immediate bystander CPR and the use of AEDs is a crucial element in enhancing a victim's chance of survival. The ACC supports this bill, which would place AED in all schools in DC and require training of personnel in each school in the proper use and maintenance of the automatic defibrillator. I urge prompt passage of this bill. Enactment of this measure would constitute a major step forward in promoting population health in this city. The measure before the Council is a strong bill, and I'm particularly pleased with the following provisions: its applicability to all schools in this city, public, charter, parochial, or private; the extensive list of individuals who must complete a CPR and AED program, including coaches, assistants, athletic trainers, the team or game physician, each school nurse, and anticipated AED users designated by the school principal; and the requirement that at least one individual be present during the school's hours of operation and during any athletic event. In urging the Council's prompt passage of this bill without weakening amendments, I must elaborate on the college's broader objectives regarding AED and CPR use. This is an important incremental building block upon the 2000 AED law. Enactment of this bill will promote the ACC's population health objective in the District of Columbia, and it will save lives.
Doctor, if you could summarize your testimony.
Yes. This is by no means the final objective. The college supports requiring all DC high school students to receive AED and CPR training as a graduation requirement from DC schools. We want to work with all stakeholders to achieve this objective in the near future. 26 states, including neighboring Maryland and Virginia, have enacted legislation requiring high school CPR training as a graduation requirement, and today you will hear testimonies from individuals in enacting this legislation in Virginia. And we commend their story to you and hope that the District of Columbia will join its neighbors soon. Thank you.